The first step to diagnosing lung cancer is screening. This can help look for cancer before a person has any symptoms and help find cancer at an early stage when it may be easier to treat. The diagnosis process overall is going to be different for every person, and the medical team will base determining tests on medical history like smoking, symptoms, and findings from the physical exam. Imaging tests are then ordered to help find cancer, see if it has spread, see if treatment is working, or find cancer that has come back after treatment. These imaging tests are CT scans, PET scans, and bone scans. Other tests may be ordered if there is something suspicious found in the imaging tests. Such exams look closely at tissue and fluids such as a bronchoscopy, an endobronchial ultrasound, or a fine needle biopsy. Even more detailed testing of the tumor will look for mutations in the DNA and levels of specific proteins to allow for more specialized therapies. Types and staging is the final process in diagnosing lung cancer. There are two major types: non-small cell, which makes up 85%, and small cell, which makes up 15% of lung cancer. The most common type is non-small cell adenocarcinoma, and there are 4 stages depending on how far it's spread. Small cell lung cancer results from smoking even more so than non-small cell lung cancer. It grows rapidly and spreads quickly, but is more responsive to chemotherapy. There are 2 stages, limited and extensive, depending on how far it's spread.
Up to 25% of people who are diagnosed with lung cancer have no symptoms at the time the cancer is discovered. For those who do have symptoms, some of the cancer-related ones are shortness of breath, wheezing, chest pain, cough, hoarseness, difficulty swallowing, and unexplained weight loss. When cancer metastasizes and moves on to other tissues, some of those symptoms can be pain in the bones if the cancer is spread to the bones, and other neurological symptoms if the cancer spreads to the brain, such as blurred vision, seizures, and confusion. Paraneoplastic symptoms are those when the cancer cells start to secrete hormones on their own. In lung cancer, a common paraneoplastic symptom is the production of too much ACTH, which leads to an oversecretion of cortisol by the body.
The pathophysiology of lung cancer is caused by many things. One thing is that the damage and mutation to the genetic code of lung cancer cells can cause uncontrolled cell growth, inhibition of apoptosis or programmed cell death, the development of a tumor, damage to the genetic error-correcting machinery of the cell, damage to the tumor-suppressing gene so that the tumor will not be suppressed by this gene and the tumor can continue to grow. And it can also cause errors in the signal machinery that prevent cells from detecting other affected cells. Tumors can form and the tumor can encourage angiogenesis. Then the blood vessels will develop and come and feed the tumor so that the tumor has nutrients. The growth of the tumor can increase the risk of metastasis.
Okay. Damage and mutation to the genetic code of lung cells can be caused by 3 major factors: cigarette smoking, which accounts for 85% of lung cancers, environmental exposure, and genetics. Cigarette smoke, which is known to contain more than 60 carcinogens, one of which includes polycyclic aromatic hydrocarbons, or PAH, such as benzoalpha-pyrene, which causes mutations in the p53 gene, more specifically mutations affecting the GNT transversion in the p53 gene. Nicotine in the cigarettes also acts as a promoter for carcinogenesis by inhibiting apoptosis, proliferating cells, and causing angiogenesis. For environmental exposures, occupational exposures such as asbestos, tar, and soot can damage and mutate the genetic code as well. Metals such as arsenic, chromium, and nickel can do this, and exposure to radiation can obviously cause mutations. And lastly, we can move on to genetics. Increased risk of lung cancer can be found among first-degree relatives. Several enzymes in cytochrome P450 system can increase risk factors, and certain alleles for the gene CYP1A1 which codes for aryl hydrocarbon hydrolysis, or hydroxylase, are thought to increase the risk of lung cancer by increasing metabolic activation of protocarcinogens that are derived from cigarette smoke.
So for treatment and management, treatment is based on the type of lung cancer you have, where the cancer is within the lung, and your general health. Small lung cancer is mostly treated with chemotherapy, and you may also have radiotherapy to treat this type of lung cancer. Non-small lung cancer can be treated with surgery, chemotherapy, radiotherapy, or a combination of these, depending on the stage and where the cancer is diagnosed. Some people with advanced lung cancer may have biological therapy. Pain management is particularly important for cancer patients, considering 1 in 3 patients continue to experience pain after treatment. Those with advanced cancer are most likely to have severe pain. For example, chemotherapy can lead to peripheral neuropathy, which is a condition that includes tingling, numbness, and weakness in the hands and arms or legs and feet. However, 90% of cancer patients get relief from relatively simple pain management therapies, and these include prescription medication, nerve block therapy, physical therapy, acupuncture and auricular therapy, massage therapy, and chiropractic treatment.